Senior living communities are all different, as we know, especially when it comes to amenities and medical care. But we have one of the best in the area right here in Savannah, the Coastal Empire and Low Country. And of course, I'm talking about Savannah Square Senior Living. Joining us now to talk about that is Health Center Admissions Coordinator Chiletta Lester. Hi, Chiletta.
Hi, how are you?
I'm great. It's great to see you. Well, let's jump right in because there's a health center right there on the property at Savannah Square. What exactly is skilled nursing care, and why is that important for a community like Savannah Square?
Well, in Savannah Square, we are a continuum care retirement community. So we do have independent living, assisted living, and also residents that are in a health center. For them that are following a hospitalization or an illness or surgery, getting them rehabilitated and offering skilled care and therapy services is very important to their quality of life. So.
And we're talking about a wide range of care that you offer there.
Absolutely. Physical therapy, occupational therapy, speech pathology, along with our 24-hour skilled nursing care by licensed nurses.
And it really is geared to the individual because it's not a one-size-fits-all. Let's talk about some additional services or amenities available for residents in the health center.
Once a resident comes into the health center, they are part of the Savannah Square community. So there are several things that they can enjoy. Concierge services. We have the 5-star dining experience, full-service beauty salon, mobile dentistry services for our residents that are in the health center. So there's a plethora of things that are available to them. And just because they're in the health center doesn't mean that they don't have access.
But this is really a better way of life, and you're seeing success stories with this. You know, senior living environments have changed so much over the years. Chiletta, what are some common misconceptions do you think about skilled care or inpatient rehabilitation services?
I often speak with families and residents that are a little bit fearful about going into a facility for therapy or rehab, because oftentimes they're thinking that they're going to be admitted and they may never make it back home. And that's so far from the truth. We have successful outcomes with our therapy and rehab. Our goals are for residents that come in, for them to maintain their independence so they're safe when they're discharged back into the community.
What can residents and families expect to experience once in the health care center at Savannah Square?
Once we have residents that come into the health care center, first and foremost, we provide information. We share information. A lot of times, whether it's children that are taking care of their parents, this is the first time they've had this type of event happen following a hospitalization. So there's a lot of things that they may not understand or may not know. So we take time with them. We're very patient. We understand that this is a major decision to admit someone for rehabilitation or even for long-term care.
So, and you know, in talking about the myths that we were just mentioning just a second ago, you talked about being fearful. So how does Savannah Square address resistance for those who are hesitant to be admitted to inpatient services? Because that has to be difficult.
It is very difficult. We will make on-site visits where it's to the hospital or to their home. A lot of family members are residing out of state, so we provide information about our support groups, such as our Alzheimer's support groups, care planning, involving them in those meetings so they are able to be informed of every step of the way of the care of that resident. And the resident themselves, they're the experts on their lives.
You know, Chiletta, a lot of viewers watching right now, and they're always looking for helpful tips. What are some helpful tips for families interested in finding out more information about being admitted to the health center?
It may be helpful for them to make a list of questions or concerns that they may have so they can probably be addressed, whether it's over the phone when they call in or once they come in for a tour. Questions such as the availability of our medical director, nursing staff, things to expect moving forward, discharge planning. All of those things are very important to have answers to prior to someone coming in for admission.
And you know, I love the fact that your doors are always open. You don't necessarily have to have an appointment. Your doors are always open. You welcome the community in.
Absolutely. Residents or potential families can call for a tour, or you can come and our staff is there to greet you.
Well, you really are the experts in making life easier for our seniors, and I want to thank you for all the work that you do. Thanks, Chiletta, for joining us. It's always great to see you.
Thank you for having me, Natalie.
If you'd like more information on Savannah Square Senior Living, all you have to do is check out our Coastal Experts page at WSAV.com.